All right. So thank you so much, everyone, for attending this Friday of Labor Day weekend. I hope you're excited to be here. I know I'm really excited to be here. Just a couple of things to start out with. First of all, I realized I'm in a room with motion sensor lights. So if all of a sudden you see me jumping around, it's not because I'm having a panic attack. I'm just trying to get the lights to come back on so I can see my notes. So I'm going to start out by throwing out some definitions of words that I'll be using throughout the presentation just to make sure that we're all on the same page. Then I'm going to state the problems of hunger and food insecurity and food waste. And then lastly, I'm going to talk about Hungry Harvest and what we're doing to solve these issues. Next slide. So these are the very by-the-books definitions of food insecurity and food deserts. But I'm just going to kind of throw out some lighter terms that can also be used to describe food insecurity. So food insecurity is just struggling to avoid hunger, somebody who's hungry or at risk of hunger, somebody who's hungry or faced by the threat of hunger. Food deserts, so generally food deserts pretty much are access or income. But the methodology behind food deserts has been evolving over the years, and now there are lots of different variables that define a food desert. So generally it has to do with access to fresh, affordable produce. So access, how far away are you from a grocery store? And then somebody's income. But recently there have been methodologies coming out that include more variables such as car ownership, which is a huge factor of whether or not somebody is going to have access to fresh produce. And even another thing that's called the Healthy Food Availability Index. And that's when people actually go inside grocery stores and look at the quality of the produce, because somebody might have access to a grocery store, but that doesn't necessarily mean that the produce there is affordable, and doesn't necessarily mean that it's going to be high quality. So generally, food deserts are just those areas with higher concentrations of fast food restaurants, higher concentrations of corner stores that don't really have fresh, affordable produce, and high concentrations of people who are living in food insecurity. And then as you can see on the right, I pulled this image showing food deserts in Philadelphia in yellow there, and this staggering stat down there saying that Philly is one of the top 10 hungriest counties in the whole country. So now I'm going to talk about the hunger problem. I'm not going to just go read through this entire slide, but I do want to point out a couple of things. This first one being something that has always stuck with me. I used to work for an organization called Hunger Free America. And I remember my first day of orientation being just blown away by this. So we live in the wealthiest, most agriculturally abundant country in the history of the world. Yet 40% of food goes to waste every year. Nearly 50 million people live in homes that can't afford enough food, and 25.3 million people live in food deserts. Let that sink in for a minute. It's really, really staggering. So next, I just want to talk a little bit about the tie between food insecurity and health outcomes. So 83% of food insecure households purchase inexpensive, unhealthy food as a coping mechanism. This worsens their medical conditions if they are already suffering from a chronic disease. Food insecure households often have to choose between food and medicine, utilities, transportation, and/or housing. And this is something that I've experienced firsthand at some of these markets that I'll touch on a little bit later in my presentation. I remember being in Frederick, Maryland, at the launch of one of our Produce in a Snap community markets, and an elderly couple walked in. The husband had Crohn's disease and the wife was diabetic. And I struck up a conversation with them, and they were talking about how they loved to cook, they wanted to eat healthy, but they just couldn't because they had to choose between their medical bills and paying that little bit of extra money to be able to actually afford the produce. So these are, real life situations of, how people are having to make these really difficult decisions on a daily basis. So now just talking about the problem of food waste. First of all, if anyone has not seen the segment, the John Oliver segment on food waste, I highly, highly recommend it. He says that we waste 40% of our food, which is $165 billion of food every year. That's enough to fill 730 football stadiums. This goes into dumps where it decays, pumps out methane gas, which is a greenhouse gas, 25 times more potent than carbon dioxide at trapping heat. Global warming. Sorry, I had a little bit of a scratch in my throat. This is a terrible joke. I also realized that any jokes I throw out during this whole presentation, I'm not going to be able to hear any giggles or anything because everyone's on mute. So it's just going to be me kind of laughing at myself, but it's okay. I laugh at myself all the time, so I'm kind of used to that. Anyways, going back to the presentation. So this food that I'm talking about going to waste, this is somebody throwing away half a burger. This is a family throwing away a little bit of, their meal after dinner. This is maybe a grocery store throwing away food that they haven't done a great job pushing, and then that gets thrown away. But I want to focus right now on food before it even gets to these retailers, specifically produce. So 20 billion pounds of produce goes to waste every year in the United States before it even gets to these food retailers. So why is this? Look 100 years ago, produce that wasn't necessarily these cut up baby carrots or celery that, was perfectly cut in packages. All that produce was in the grocery stores, no problem. But then check out this image on the right where everything is just picture perfect, organized, and we're used to this. We've become accustomed to seeing grocery stores with this kind of produce. And so this produce is going to waste before it even gets to the grocery stores because it doesn't meet the cosmetic standards that the grocery stores want and that we're used to. So I'm going to touch a little bit more on this in a couple slides when I start talking a little bit more about Hungry Harvest. So now enter Hungry Harvest. So we have a social mission to reduce food waste and fight hunger using one problem to solve the other. So what exactly is Hungry Harvest? We are a to-your-door produce delivery service. We use a CSA model where we send boxes of assorted produce to customers on a weekly basis, and our subscribers support our hunger-solving initiatives. So we use a sustainable business model that is systematically addressing food waste and hunger. How are we fighting food waste? We're partnering with farmers, wholesalers, co-packers that can't get their produce into the grocery stores because of shape, size, and surplus. So this is an apple that's too big or too small. It's a crooked carrot. It is kale, where a farmer had too good of a growing season, and there was not the demand for them to get that kale into the grocery stores. I want to throw out a couple more examples just because I think this is really fascinating. So during the growing season, for example, when everybody across the country is growing corn, the market values a lot of times drop so low that it's cheaper for them to just leave the crop in the field than it is to harvest it. So we have a team that goes out and reaches out to them and says, hey, if you harvest that crop, we'll pay you for it. A couple other examples. We get asparagus a lot because it comes into the grocery store and the pallets might be a little bit tilted, meaning those cases are a little bit crushed. The actual product itself is absolutely fine, but it gets turned away because of that. And so that's when we scoop it up. Another example, which always blows my mind, is the 18 pallets of cabbage we got a couple years ago because it had, quote, too many specks of dirt in it. We're talking about a vegetable that is grown from the ground that was rejected for having specks of dirt in it. So again, we scooped that up, and it's a win-win because we're putting money in the farmer's pocket and we're preventing perfectly good food from going to waste. So how we fight hunger. This is where I fit into the organization. I'm Hungry Harvest Food Access Coordinator. So I work specifically on the food access, the hunger side of the mission. We're using a multifaceted approach to fighting hunger here at Hungry Harvest. So we donate a lot of produce. We've donated over 800,000 pounds of produce to date in our markets in 9 different states, up and down the East Coast and also in Michigan. So you see here, we donate produce to Fill Abundance, which is the largest food bank in the region, serving 90,000 people each week. And we donated roughly 50,000 pounds of produce to Philadelphia. And we're really excited about that. That being said, donations are just one piece of the puzzle of fighting hunger. So any business out there could make a donation, they could market it, they could get a tax write-off, and they could call it a day. So imagine, Hungry Harvest is something like this. We just did a series of one-time donations in food deserts, did it for the marketing and PR. We'd donate a few thousand pounds, we'd feed a few hundred people for one day, and then we'd leave. The press would take pictures, they'd write articles, we'd get tax write-offs, maybe we'll even get a couple additional customers from the attention. The people we feed would have produce for a few days, maybe a week, but their eating habits wouldn't necessarily change since there's no consistent option to produce and healthy eating. This does not solve hunger, and this does not solve food deserts. So enter produce in a snap. This is our second piece of the puzzle that we use in fighting hunger. So Produce in a Snap specifically aims to bring dignity, choice, and community back to the shopping experience by empowering people who are looking for fair access to fresh, affordable produce. So, light went out. No, just kidding. Light's good. So what is Produce in a Snap? Produce in a Snap is a program that we started 2 years ago when we realized, okay, we have this really unique opportunity to deliver produce to people with SnappyBT, formerly known as food stamps. So the USDA does not allow for online SNAP transactions. Now, as a produce delivery service, our subscribers use credit or debit cards and enter it in online. Unfortunately, the USDA, who administers SnappyBT, does not allow for that. So yes, they are piloting a program right now, but we didn't want to wait for that. We wanted to make an impact right away. So what we did was we started this program called Produce in a Snap, where we actually go into communities with high concentrations of people with SnappyBT, high concentrations of food insecurity, food deserts, and we partner with organizations to have weekly community produce markets where we sell low-cost produce. The core product here is a $7 bag of assorted fruits and vegetables that we advertise as being about half the cost of grocery stores. So I'm going to talk now about the specific partnerships and what makes, you know, a good partner. So far, we've partnered with schools, community and rec centers, and most recently hospitals. And I just noticed that I actually have schools on there twice. So yeah, schools, community centers, and most recently hospitals. So schools has been really interesting because we've specifically partnered with community schools, and partnering with schools is a win-win. We're addressing childhood hunger here. And again, to use a line that I got from Joel Burr, the executive director of Hunger Free America when I worked there, you can't be well-read if you're not well-fed. So we believe that by partnering with schools and having this resource available to families with children, if we can get our younger generation eating healthier at a young age, that's a habit that can continue with them for the rest of their lives. And that's what we're really aiming for. So just to speak a little bit about community schools for anyone who's not familiar, they are in Baltimore, and they're have been piloted in Philadelphia recently as well. So I'm just going to kind of read off exactly what community schools are. So community schools are public schools where a full-time coordinator works with an entire school community, students, parents, teachers, administrators, service providers, and neighbors to identify the community's most pressing needs, such as expanding medical services, after-school program, job training, etc. The coordinator then works with service providers and city agencies to bring these resources directly to the school. And the community schools become neighborhood centers, improving access to programs and services for students, families, and neighbors. So this is perfect for them, for us, for the community, for the families, for the staff, because one of those pressing needs that we found is access to affordable produce. So currently we work with 6 community schools in Baltimore, and I believe that Philadelphia has 12 community schools. So we would love to be able to expand this program to Philadelphia, specifically targeting those community schools. But that's just one of the 3, prong approach that we have. So there's also community and rec centers, which are obviously going to be super popular because they're organizations that are trying to find resources to serve the community. And so we partner with several community and rec centers as well to offer affordable produce to those communities. And then hospitals. And hospitals has been really interesting because over the last 6 months, we've partnered with 2 hospitals in Baltimore and found really, really great success because these hospitals have people working in preventative health, community health, chronic illnesses, diabetes care, hypertension care. All of these people are interested in this program, Produce in a Snap, because it benefits their high-risk patients. A couple specific examples, St. Agnes Hospital is in West Baltimore in a food desert out there. And they applied for a grant that's being used to give vouchers to identified high-risk patients that they can redeem at the market that we have there so that they can go to an appointment, whatever that appointment may be, and then stop by our market, grab a bag of produce, and then take it home with them. Another partnership we have is with the University of Maryland Medical Center, and they have a massive community vehicle, community health vehicle that they use for things such as free blood pressure screenings. They reached out to us and said, hey, we'd love to do a mobile farmers market where they can set up shop in identified areas that they need to target in order to keep their tax exempt status. So I'll read this off real quick because I think this is something really interesting, that under the Affordable Care Act, many nonprofit hospitals have to meet these new requirements to retain their tax exempt status. The majority of hospitals in the US operate as nonprofit organizations, and as such, they are exempt from most federal, state, and local taxes. This favored tax status is intended to be an acknowledgement of the community benefit provided by these institutions. So community benefit, that's what this is. It's a benefit for people in that community, or really any community that is coming to that hospital for their services. And so the University of Maryland Medical Center has identified several communities where they need to offer several resources, this being one of them. So again, hospitals have been very successful, as well as schools and community rec centers. But generally, we're wanting to target those areas that have high concentrations of people living in food insecurity, lacking access to affordable produce, food deserts. Who does what in this partnership? We have our partner organizations, and then Hungry Harvest. So our partner organizations take ownership of these markets, offering management, volunteers, to have these markets operate on a weekly basis. At schools, the volunteers, most of the time, if not all the time, are students who are getting community service learning hours in exchange for volunteering, which is really, really awesome. In some of the community and rec centers, it's people from the community. Some schools, it's parent volunteers. At the hospital, it's usually community health workers. Really anyone who is willing to put in the time to volunteer to help make the program operate. And then what Hungry Harvest does is we provide the tools for these organizations to operate these weekly markets. So we provide the produce, we provide the delivery, we provide the machines that they have to accept credit, debit, and SnappyBT, because SnappyBT is electronic in the form of a debit card like card. In Maryland, it's called an independence card. We cover the cost of all those transaction fees, all the processing fees, the bags, the signage, the markets, et cetera. So again, we're providing the tools for these organizations to bring a resource to their community that's in need. Like I said, they accept cash, credit, debit, and SnappyBT, and they are open to anyone. And I want to stress that because that is one of the parts of the program that I love the most. There are a lot of wonderful food access programs out there that are a little bit limited because they may only be able to serve people on government assistance programs. We keep this model open to anybody because I think that there are a lot of people out there who may barely miss qualifying for SNAP, for WIC, for the farmers market vouchers, disability, any of those government assistance programs. And a lot of times those are the people who are most vulnerable. So we're not going to close this off to anybody. We're not going to ask for proof of income. We're not going to ask for ID. We're not going to ask for people to sign in. We make sure that everybody feels very comfortable with the process. There's no limit to how much people can get. You can get 1 bag, 2 bags, 3 bags. We've had people come in and get a bag for themselves, for their mother, for their grandmother, who might not have the mobility to get down to the market. Sometimes they're buying for the neighbor. At the hospitals, a lot of times we get doctors coming and buying one for their patients. The whole community aspect of the market is what we're really trying to harp on. So let me go into a little more detail here about what comes in a bag. So our bags come with 2 to 3 fruits, 4 to 5 veggies, and a leafy green. So we got a picture over here on the left of what we had in a bag at our St. Agnes Hospital Market 3 weeks ago. And then these are just a couple other examples that I've pulled from previous harvests that we've sent out to markets. So like I said, there's $7 and roughly half the cost of grocery stores, but it also depends on where we're serving. So right now we're in Baltimore, but we're about to expand to DC. In DC, this produce is going to be a lot more expensive. So it might be a third of the cost of what it would be at a grocery store. So I know what a lot of you are probably thinking right now. What if somebody doesn't want zucchini? What if they don't like it? What if they don't know what to do with it? What if they don't know how to prepare it, cook it, store it? It's a great question. And you're probably thinking, Will, you were telling us earlier that you're trying to empower people to eat healthy, but how are you going to empower them if they don't have any choice? Well, replacement items. So every market has between 3 and 4 replacement items that they are allowed to swap into the bag for an item that maybe they don't want. And there's no limit to how much somebody can mix and match. So let's say somebody didn't want that zucchini, that they can swap it out for, let's say, apples. And we strategically work on what produce goes in those bags and what produce we have as replacement items to make sure that people are getting produce that they want. We're not going to be sending a lot of eggplant and butternut squash and Romanesco, stuff that people are going to look at and be like, I have no idea what to do with that. But if we do, we also send out recipes. So if we send eggplant, we'll pass along recipes for eggplant pizza or eggplant burgers, which I just found a great recipe for. But generally, we try to make sure that we're sending appropriate produce so that people are going to be able to take home a bag of produce that they're going to really, really enjoy and value. And then one more cool thing about the program is that we also have what we call flash sale items. So generally, we're not going to be able to get a whole carton of strawberries or watermelon in the bag, but we can still stick to that model where we're selling the produce at half the cost of grocery stores, and allowing people to really save money. So a 2-pound bag of grapes is what, $4 at a grocery store. Cherries would also probably be about that. So we'd sell pineapple, watermelon, grapes for $2. We'd sell 2 avocados for $1, where I know that avocados are at least $1 a piece at a grocery store. So a lot of times people will come, they'll grab a bag, they'll swap a couple things out, swap a couple things in, and then they'll grab a bag of grapes to take home. So that's the general model of what it looks like at one of these markets. So these are the core tenets of success for the program. First of all, I've touched on affordability, on how they need to be affordable and accessible. So making it $7, half the cost of a grocery store, making sure that we can make it as inexpensive as possible, making them accessible, making sure that we're targeting appropriate neighborhoods where fresh affordable produce is not currently accessible. Sustainable. This is also very important. So we need to make sure that because we're sending, this produce out, covering the cost of delivery, we need to make sure that we're covering the cost of goods sold, we're covering the overhead, and making sure that we're having enough people come out on a weekly basis to make the program sustainable. And then also scalable. So right now in Baltimore, we have 1 in 4 people living in a food desert. But food deserts and food insecurity, hunger, these are not issues just in Baltimore. They're issues in Philly, they're issues in DC, they're issues all over the country. I mean, like I said earlier, we have nearly 50 million Americans who are living in food insecurity. So our goal is to scale this program to all of the markets where we serve in Hungry Harvest. I mentioned earlier that we're in 9 states. We envision this program expanding to all of those states and any state that we decide to expand Hungry Harvest to make sure that we can continue to fulfill our mission and fight hunger and fill food access gaps until there are no more. I've kind of touched on consistency. We want to make sure we're operating on a weekly basis all year round. Farmers markets close at some point. So those are amazing resources, but once those close, then, we want to make sure we're still running. In the summertime, we want to make sure we're running in the summer. That's one of the most vulnerable times of the year for food insecure families. They can't rely. I mean, their summer food programs, which are absolutely wonderful. And we want to complement those programs and make sure that while families can't rely on those school meals all the time, that they can have an affordable produce market that they can go to. We really want to build trust in the communities that we're going to be there for them on a weekly basis, that they can make this a part of their weekly shopping routine and have fresh produce on their table on a weekly basis. In demand, obviously that's very important, and I've touched on that as well. So we have a food access coordinator who works very, very closely with our site coordinators who manage the markets to collect feedback on a weekly basis. What are people liking? What are people not liking? What are people swapping out of the bags? What are people swapping into the bags? That allows us to tailor to the needs of each market. So I just got back from a couple of back to school resource fairs for a couple of our markets in East Baltimore. East Baltimore has a high percentage of Latino families. And so I'm going to be sending tomatoes, kiwis, mangoes, avocados, jicama, corn, for example, out there. And that's all based on feedback I've gotten from these markets versus West Baltimore, where I'm going to be sending more fruits and more snackable veggies. And again, all of this is based on feedback that we've gotten from these markets. So every market is going to have very specific produce based on the needs of that community. And then lastly, we want to make it simple. Our site coordinators and our volunteers are rock stars. We could not do this without them. And so we want to make this model as simple as possible for them so that everything runs really, really smoothly. I love maps. So here's a map of where we are in Baltimore. The food desert map that you see here was put together by the Johns Hopkins Center for a Livable Future with a partnership with the Baltimore Food Policy Initiative. So all of the yellow are food deserts, and all of those little red dots are the markets where we are operating. We have 16 markets right now throughout Baltimore City and Frederick, Maryland. So you see Frederick over there on the right. And as I mentioned earlier, we are expanding to 2 markets over the next few weeks in Ward 8. If any of you are unfamiliar with DC, Ward 7 and 8 are among the most impoverished areas of DC where this is in the most need. And we're partnering with Capital Area Food Bank right now to launch down there. So Capital Area Food Bank received some grant money that's going to help us cover some of the upfront costs. It's going to help us cover some of the transportation costs to get the produce down there. These SNAP machines, which are not inexpensive, and just devoting some of their time to help us find successful markets. So I mentioned earlier what makes a successful market in these schools, in these hospitals, in these community centers. So I was born and raised in Baltimore and have been able to do a lot of research making sure that we're forming successful partnerships in the city. But I don't know DC. So working with an organization like Capital Area Food Bank is wonderful because they know that city and they know what's in need and they know where we can most successfully serve communities in need. All right, and these are just some quotes that I've gathered from people just to show the impact that we've had. I think to this day, the most impactful quote has come from that conversation I had with the elderly couple in Frederick about how thankful they were to have that market so that they could actually start eating healthy and also cover their medical bills at the same time. It also is always adorable when you have a child come and eat a piece of fruit that they've never had before. A lot of times we had one, I think there's this quote on the right where this little girl's face just absolutely lit up when she tried a mango for the first time. And it was a little bit funny because without us even being able to tell her how to eat a mango, she just bites right in. And you can eat the outside of a mango, but most people will cut it open, and she just goes and bites right in, and just the look on her face was just pure happiness. And I was able to speak with her mother for a little bit, and her mother was telling me about how wonderful it was to expose her children to these different types of fruits. Kids want to eat produce. Kids like, especially fruits. So it's really, really exciting that we're able to provide this resource to them. And senior citizens as well, as you see in that quote on the bottom right there, especially when they don't necessarily have the mobility to get out to supermarkets if they're living in an area that doesn't have one anywhere nearby. These are just some straight up numbers. They're a little bit out of date. I think that these are only updated through maybe July. But we've come a long way since we started 2 years ago, providing over 200,000 pounds of low-cost produce to people in need. And we're nearing 5,000 people served. Some of these pictures I think are really awesome. This one, the second from the left, is one of our markets over in Southwest Baltimore, and you can see our site coordinator explaining the program to some families that have just come from the school nearby. So again, just throwing out some numbers there. And then lastly, expansion. So like I said earlier, we're planning on expanding to all of these areas where Hungry Harvest is currently operating and is planning on operating. I wouldn't be here today talking to you if I didn't have a plan to expand to Philly. So the goal is to expand to Philly by 2019. We want to pilot the program, ideally at one site, similarly to how we're doing it in DC, where we're just starting small, starting with a couple of sites, seeing how things go, seeing what the demand is, seeing what people like, what people don't like, how the model works, how people respond, just because Baltimore is very different than DC, which is very different than Philadelphia. And we want to make sure that we're doing our due diligence to really make a big impact in Philadelphia. So, so please, Kyle told me that he was going to pass on a one-pager that I sent him, as well as a PowerPoint to everybody attending. It does have my contact information. Please feel free to reach out to me if you'd like to learn any more about this program, if you're interested in helping us bring this program to Philadelphia. If you're an organization that has any connections to hospitals that you think might be a good fit, community rec centers, or one of these 12 community schools in Philadelphia, or maybe we're missing something. We started 2 years ago only partnering with schools. Then we started partnering with community centers. Then we started partnering with hospitals. We're constantly innovating this model to serve the areas we need. So maybe hospitals are a big hit in Baltimore. Maybe they won't be in DC. Maybe schools are a big hit in DC, but they're not in Philly. We're learning as we're going, and we're never going to say no to an idea. Definitely interested in doing anything we can to make an impact in the cities where we're going to be expanding to. So again, we're really excited to be focusing on expanding to Philly by 2019. So that's everything I got for you guys. Thank you so much for taking some time to hear me out, to hear about these issues in hunger, these issues in food waste, Hungry Harvest, and what we're doing to address them. I think now I guess we'll open it up to questions. How's that sound?
Sounds great. Thank you so much, Bill, for your informative presentation on what you guys are doing in Baltimore and DC with Hungry Harvest. We do have a couple of questions that were presented during your presentation. Two of them actually you addressed. You did share that you are looking to expand to Philadelphia in 2019. You kind of touched on what that will look like and kind of the strategy you guys are going to take on how to expand in Philadelphia area. One of the questions was, outside of Philadelphia, will you be thinking of expanding to the Delco area, which is our Delaware County area? Are you planning on moving beyond Philadelphia?
Yeah, so I think the short answer to that is kind of like I touched on earlier. I don't see us simply saying no to things. It's one of those scenarios where, I'd be more than happy to talk that out if there are areas such as what you're describing that could be in need and where we could make an impact. So I will be working closely with our Philadelphia market manager, Vanessa, who's on this call. Hi, Vanessa. So we will, be looking into areas in Philadelphia and maybe some of these surrounding areas to see if we can potentially make that work. So I don't have a definite answer of like yes or no, but we would definitely be open to it.
I think it will be helpful too, since Kyle has some of your information. Perhaps those who are interested can contact you directly or Vanessa to further inquire about such areas as Delco, how they can partner with you to see how that will work in their area.
Yes, please do. And I really, really highly encourage anyone and everyone here to reach out to me. If I'm getting 100 emails in a day, then that's a good day. So.
Okay. So we have two more questions. One was a suggestion that an idea of probably partnering with libraries.
Mm-hmm.
Your program. Oftentimes, a lot of times in Philadelphia, a lot of our homeless populations frequent our libraries. It could benefit from your services. So that could be a possible partnership. Just throw it out there here in Philadelphia. Also, someone asks if you could review again how people can pay with their SNAP benefits.
Sure. So as I mentioned earlier, SnappyBT is just a card, just like a debit or a credit card. And we have at each one of our markets what it's called a first data terminal that we use through Bank of America Merchant Services. It's a wireless terminal that can work inside, outside, doesn't need to be plugged in. And our site coordinators are trained how to use them. And somebody would go up with their SnappyBT card and our site coordinator would swipe it just the same way that they would swipe it for a debit or a credit transaction. So it's really no different than a debit or a credit transaction. It's very simple. And I think when Snap went electronic back in 2008, I could be wrong on that, but back when it went electronic, it made the playing field very equal so that people would be able to use that card and not have, the stigma behind, the food stamps.
Okay. Another question was, does the site coordinator keep it at their location? I'm assuming keeping the program at the location.
Yes, that is correct.
Okay. And there's another question referencing what are the 12 community schools in Philadelphia that you may have referenced?
That is a great question. I can maybe send that. So I have it on. I found it online. I can send that link to Kyle, and maybe he can send that out with the PowerPoint in one pager. Does that sound?
Okay.
Absolutely.
And to be very honest, this is something I've been doing preliminary research on. So I know that there was supposedly one cohort of 9 community schools in 2016, and another cohort of 3 schools in 2017. I did not follow up to see, if they stuck to that timeline and if those community schools are still operating as community schools. But I will definitely be doing more research, over the next few months to see what that looks like.
Okay. And one more question. I know you were projecting the expansion to take place here in Philadelphia in 2019. Would that be the winter, spring, fall, summer?
It's a great question. So our priority right now at this moment is to make sure that we're following through with our DC expansion. And then after that, which again will be in the next few weeks, we're going to start looking into DC. So the reason that I say 2019, I guess, I didn't put a month. So January would ideally be the time frame. And that's just because we found that November, December tend to be slow months with the holidays. And so people tend to kind of come back fresh in January. And we have very, very high months of sales in January, which may or may not be surprising, but we do have, it tends to be a really popular month. So I would say that we would be shooting for January.
Okay, thank you. Another question just was presented. Have you considered partnering with local CDCs who house neighborhood advisory councils under Philadelphia Division of Housing and Community Development?
That's a great question. That's something that I would definitely be interested in looking into in Philadelphia, because like I said, every city is going to be different in what's successful and what's not, and what's more successful than others. So in Baltimore, we haven't had too much success with CDC's housing authorities. It just hasn't really worked out. But that's not to say that it wouldn't work out in Philly. So that is definitely something that I would like to explore.
Okay. Could you share a little bit about the startup criteria and the costs for establishing a produce in the SNAP market?
0. I don't know if you guys can actually see my face or not, but nothing. There's no cost. That's one of the beauties of the program for our partner organizations. I guess you could argue time is money. So the only cost is having somebody's time dedicated for those couple of hours once a week to manage that market. But we have a lot of markets where, maybe the school is super busy and they have 3 site coordinators who take turns once every 3 weeks taking the lead on the market. But yeah, there's no cost for the market other than the time it takes for the management.
Okay. Thanks for answering those questions. Are there any other questions out there that you may want to ask?
All right. So those are actually really helpful questions and elucidated a lot of my questions as well.
Mm-hmm.
So to all of you in attendance and to all of you who have participated in asking questions, thank you. We couldn't do this without you. And one of the big things about these webinars is connecting folks. So like Will said, we will be sending out further information and further follow-up details, as well as the PowerPoint. So like I said, keep your eyes and ears open for that. And Will, thank you so much for this. This was really great. And we're looking forward to seeing how this shakes out in Philly.
Mm-hmm.
You and me both. I'm very, very excited.
Okay, thank you for your time.
And everyone, thank you for attendance. So
Have a great holiday weekend.
Awesome. Thank you, guys.
Thank you, everybody.